In 2020 alone, 2.3 million women were diagnosed with breast cancer and 685,000 deaths were recorded worldwide in just 1 year. The most common cause of cancer death in women is breast cancer. 1 out of every 10 to 12 women will suffer from breast cancer. But the good news is that with enough awareness and education and healthy practices, the same 1 in every 10 to 12 women can prevent breast cancer. Dr. Juliana Ome is the name, and the topic for today, as you already know, is breast cancer. The month of October is set aside for the awareness of breast cancer, and I'm here to share some information with us on what breast cancer is, the tips on early identification, and of course, the little we can do within our powers to stay healthy. I want to specially dedicate this health talk to everyone who has been diagnosed with breast cancer, every family who has lost a dear one to breast cancer, everyone that has successfully survived breast cancer, and of course to all the patients I have attended to, especially in the past weeks, those whose surgeries and care I have been involved in. My heart goes out to you, and I want to say this to you: keep being strong. Breast cancer is seen in every country of the world. Both men and women can have breast cancer, but the highest number of breast cancer cases is seen in women. So this episode of our Health Talk features breast cancer in women. So I will start by telling us what it is not. Breast cancer is not a transmissible or an infectious disease. It cannot be transmitted to another person. It is not like HIV that someone can get maybe from another person, maybe through unprotected intercourse, or like cervical cancer, which has a particular cause, mostly the human papilloma virus, which can also be prevented by taking the human papilloma virus vaccine. Breast cancer does not have vaccine that can protect one from it. Breast cancer is not a communicable disease, which means that you cannot get breast cancer by touching someone that has it. Now let's take a look at what breast cancer is. The word cancer means something that has projections that can go far from its original spot, something that has ability to extend beyond its boundary, and that gives out the shape of a crab. This explains the nature of the disease. Cancer has the ability to enter other parts of the organ where it is situated, and then to the whole body if it is not controlled. Breast cancer is the presence of cells that can overgrow their boundaries inside the breast. So the big question now is, why will cells grow beyond their boundaries? In life, there's what we call orderliness. Every normal cell in the human body follows this rule of orderliness. Every normal cell knows where to start and where to stop. The cells in the human body all understand this language. And the courageous thing about the human cells is their ability to die once they disobey or once they are old. This is called cell suicide. The cells commit suicide. No need for long stories. Once there's a problem that cannot be repaired by the cell system of the body, that cell is taken out. The cell dies off and leaves the body. But then there's some form of security checkpoints that help to ensure that every cell is in order. These security agents are in the form of genes. The commonest one is the gene P53. It's like a gatesman. It stands and waits. Once any abnormal cell is noticed, it stops it from going further, and that cell ends its own journey there and then. This helps to maintain order and to keep the system clean. Sometimes bad cells escape the security agent, or the security agent itself becomes faulty, maybe mutation, so it's not able to do its work. When these bad cells escape the security agents, they carry on with life, even when they have some abnormalities. That way, the cells can continue to grow and eventually disobey the proper order. In the case of breast cancer, there is no exact cause as to why cells will go beyond boundaries and grow until they form a tumor. But there are different things that have been noted to increase the likelihood of developing breast cancer. These things are called risk factors. And one of the biggest risk factors responsible is a chemical substance produced in the body, a hormone called estrogen. I want us to picture the body of a young woman like a farmland. The land is exposed to different things, both good and bad. Rainfall, early morning sun, nutrients, manure, fertilizers, harsh weather, even radiations, and so on. In similar ways, the body of a woman is exposed to nutrients, clean water, fruits, vegetables, chemical substances called hormones, harsh weather, harmful radiations, unhealthy foods, harmful chemical substances, and so on. The list is endless. Estrogen is one of the hormones that helps the female child to become a woman when she reaches maturity at puberty. It helps with breast development and development of the ovaries in preparation for menstruation and childbirth. Estrogen also protects the heart and blood vessels of a woman. So estrogen is a good guy. But excessive exposure to it is where the problem lies. Because estrogen helps the breast to develop, so it acts on the breast cells. One of the strongest things a woman's body is exposed to that increases her chances of coming down with breast cancer is this hormone called estrogen. The body of a woman is exposed to estrogen from the moment she attains maturity until menopause. And within these years, the only time she's not exposed to estrogen will be during pregnancy or during some periods during breastfeeding. Because estrogen is a hormone of the female body, the strongest risk factor for developing breast cancer is the female gender. Just by being a female, someone is already at risk of having breast cancer. So whatever causes the body of a woman to be exposed to estrogen for a very long time is considered a risk for developing breast cancer. Things that can make a woman's body to be exposed to this estrogen can be from within the woman's body or from external sources. So the internal sources will be early age at first menstrual flow. This is called early menarche or late menopause. A woman sees her menstruation for years, well into her late 50s. Age at first pregnancy, when a woman gets pregnant at an older age for the first time or choosing not to have children at all. That way, the body is always having monthly exposure to estrogen. Choosing not to breastfeed a baby after childbirth or breastfeeding for a very short period of time. While the external sources of estrogen will be combined oral contraceptives, what we use for family planning. Post-menopausal use of hormone therapy. When a woman stops seeing her menstrual flow, she expresses certain things like heat flushes, dryness, various forms of discomfort. Some women are not able to cope with all these symptoms, so they have to take hormones to look as though their bodies still produce hormone. That way, they'll be prolonging their exposure to estrogen. Other risk factors will include family history of breast cancer and even other cancers like cancer of the ovary or colon cancer. Although the lack of a family member with breast cancer does not mean a woman is at a reduced risk. Because many women who have developed breast cancers do not even have family members who have had breast cancer. The only thing is that once there's a family member that has breast cancer, the chances of having breast cancer for other members will increase. The next risk factor is genetic mutations, and the commonest one is BRCA1 and BRCA2 genes. BRCA gene means breast cancer gene. Everybody has BRCA1 and 2 genes. Normally, the BRCA genes protect the body from getting certain cancers, including breast cancer. But when there's mutation in BRCA1 and 2 genes, they are not able to do this protective function. Mutation simply means damage, foundational fault. The original substance is not the way it is. And when such damages occur, they can be inherited by children from their parents. And mutation can affect any gene in the body, such that if anyone is having mutation in BRCA1 and 2 genes, that person can come down with breast cancer and even ovarian or other kind of cancers. So when you hear someone is positive to BRCA1 and 2 genes, it simply means that person has mutation in BRCA1 and BRCA2 genes, and that's a risk for developing breast cancer. Then age. The chances of developing breast cancer will increase as a woman grows older. Other things like obesity, lack of exercise, harmful use of alcohol, exposure to radiations. Radiations cause mutation in a gene, and once a gene that should protect you is having mutation, then the chances of developing breast cancer will increase. Then smoking. Young persons are gradually developing the habit of taking shisha. Shisha is worse than cigarette. These smokes are harmful to the body. They produce chemical substances that will increase the likelihood of developing cancer. Then unhealthy diets. Eating foods that contain preservatives, canned foods. These foods contain chemicals and they are harmful to the body. Smoked and processed meats. Research has shown that eating smoked meat over a period of time increases the chance of developing breast cancer, because the smoke, when it is mixed with oil from the meat of fish, will form some chemicals like aromatic hydrocarbons, and these things can cause cancer. They are called carcinogens. Also, the risk for developing breast cancer can be divided into modifiable and non-modifiable factors. Modifiable means something you can change, something you can control. Example, smoking, excessive intake of alcohol, refusing to breastfeed after giving birth to a child, the use of combined oral contraceptives. These are things you can change, so they are modifiable. While non-modifiable means things you cannot change, you don't have control over it. For example, family history of breast cancer. You cannot choose the family you come from. You're just born into a family, right? So you cannot change it. Family history of other cancers or family history of mutations of BRCA1 and 2 genes. Age at first menstruation or the age at menopause. No one can choose the age they start seeing their menses or when they stop. So these are things you can't change. Now, how do you know when you have a breast cancer? The symptoms. I want to start by telling us that not all breast lumps are cancers. Many breast lumps are not cancerous. They are benign. So breast cancer can present in different forms. At an early stage, it can appear as a breast lump or thickening in the breast, a painless lump in the breast. It can appear as change in the breast size, one breast being bigger than the other, obvious change in, the sizes of the breast. Changes on the skin of the breast. The skin of the breast would look like the back of an orange peel, dimpling. When there's change in the nipple, or you notice that the nipple is pulling inwards or going towards the side. Abnormal nipple discharge, can be bloody discharge, can be pus. At advanced stage, you can have open wounds on the breast, ulcers, and it start growing big. And again, having veins showing on the breasts, the hand of the patient will grow bigger. The person may even be losing weight or start coughing or bone pains. Once a patient presents with features suggestive of breast cancer, the patient will have to undergo various procedures to confirm that it is breast cancer. Meanwhile, breast cancer has treatments, and there are various treatment options. Operation is done. The affected breast is removed. This operation is called mastectomy. Then the use of anti-cancer drugs. These are called chemotherapy. There are different types of chemotherapy, and the combination of drugs used for a case of breast cancer depends on the nature of the disease. Like some breast cancers are estrogen receptor positive, while some are triple negatives, and so on. So the combination of drugs used for one patient may be different from what is used for another patient. Depends on how the patient presents. And then you can do radiation. Some patients will have to undergo a series of chemotherapy before operation is done for them, while some will do operation first before going into the chemotherapy. It all depends at the level of the cancer when the patient comes. It is always best to present early, so please don't sit back being afraid or guessing. Just be courageous and present yourself for help, okay? And make sure to undergo every stage of the treatment, because the success of treatment of breast cancer is not complete until the patient has gone through all the stages of treatment. Partial treatment does not lead to positive outcome. Some patients get tired along the way and they default. After many years, they come back, and most times it's already too late. Some patients disappear after operation. Operation is not the end of the treatment of breast cancer. There are other things that will be done for you, and you need to undergo follow-up. You need to be checked at intervals to monitor your body and be sure that you're cancer-free. Sure, but then I want to share something with you, and I wish we get it properly. I want to quickly make an emphasis. You see, anything you have control over in life, you have overpowered that thing. If you have been following my health talks, you must have heard me say that nature is perfect. During pregnancy, for the period of 9 months, the body prepares itself for the process of breastfeeding. And at the end of the journey, some persons hold back what they should have given out. There is something common in majority of cases of breast cancer, and that is the lack of breastfeeding despite having given birth. Some years ago, in some parts of the world, breast cancer was a foreign disease, and one of the practices in those areas was breastfeeding up to 2 or even 3 years. But now those areas have changed this beautiful habit, and what they have is increase in breast cancer. Young women, I want you to listen to me. There is nothing fanciful about not breastfeeding. When you breastfeed your baby with breast milk only for the first 6 months of life, and then continue breastfeeding and adding other feeds for the next 2 years of life or even beyond, you protect yourself and your child is well nourished. That way, everyone wins. So the first tip on breast cancer prevention is breastfeeding. As a woman, if you have the privilege of giving birth to your own child, please do well to breastfeed that child. It might be challenging, especially after the maternity leave, to keep up with breastfeeding, but it is doable. Planning. One thing that makes the difference between Mrs. F, who copes better with motherhood, and Mrs. A, who may be struggling with motherhood, I bet you, is planning. While you're still pregnant, work on your schedule. Arrange your leave time. Look for alternative working plans. Get domestic help. Get your mother or mother-in-law who has retired to come around and assist you. Build your support system. Plan yourself and you will get the best out of breastfeeding. Other things that we can do to prevent breast cancer will include diets. As much as possible, develop healthy eating habits and be deliberate about it. My formula for healthy eating is to avoid eating naked food. What I call naked food is any food without vegetables, without dressings. Try and replicate the colors of rainbow on your plate. Beetroots, watermelon, fresh tomatoes, carrots, bananas, avocados, vegetables like spinach, pumpkin, lettuce, cucumbers, green peppers, apples, blueberries, onions, grapes. Take advantage of all the things we have in nature. The more natural your food is, the healthier it is. Colorful things, very tasty, nutritious things that you should eat. Eat nuts and grains. Choose plant proteins over animal proteins at all cost. Take lots of water. If you're thirsty, please go for water instead of the fizzy drinks. Make it a habit and you'll enjoy your health. Avoid eating excessive sugary things, too much carbohydrates and fatty foods. Avoid processed foods, canned foods, smoked meat and fish. Avoid food stored with preservatives. If you must eat these things, please make it very minimal. The poison is in the dose. Don't forget that. Just tiny portion and then eat them once in a while if you must. Generally, just be conscious of what you put into your mouth. Don't wait to develop a health condition or a problem before you become careful. Start now and let it be a lifestyle. Avoid smoking and excessive intake of alcohol. Run away from cigarettes, smokes. Run away from them. Those smokes are carcinogens. Run away from excessive alcohol. Increase your physical activity. Avoid excessive weight gain, especially after menopause. Avoid exposure to radiations. These ways you protect yourself from breast cancer. And very closely related to prevention of breast cancer is early identification of breast cancer. This is very important. There are ways to pick up breast cancer very early and you live a normal life. The first one is self-breast examination. This should be done once every month, about 1 week after your menstrual flow. Keep to the timing. 1 week after your menstrual flow every month, examine your breasts and check properly. The second one is clinical breast examination. This is the breast examination done for you by your healthcare giver. It should be done once every 3 months. Every young woman should go for screening to the hospital once every 3 months and get your breast examined. Between the time you go to the hospital and when you do, if you notice any change, anything at all, go back to your doctor. Then option of using imaging, like ultrasound. Ultrasound is a breast scan. It's like every other ultrasound scan you know. It is for younger women or pregnant women or breastfeeding women who need their breasts checked. It is harmless. The second imaging option is mammography. It should be done for women 45 years of age and above. Mammography is a special kind of X-ray used to create detailed image of the breast. It uses low-dose ionizing radiation. The beautiful thing about mammography is that it can detect very tiny lumps, even before they are big enough to be felt by the hands. And this should be done every 3 years. Then for those that have family members who have had breast cancer, you can go for genetic testing to check for the presence of mutation in BRCA1 and 2 genes. And that way you're going a step further to be cautious enough to protect yourself. In conclusion, breast cancer is the commonest cause of cancer death in women. But taking the right steps towards prevention and early detection will make a great difference. Don't be afraid. Having the right information is not enough. The impact is in practicing what you have learned. My wish is that above all things else, you should be in good health. Please do well to share this information with others. Forward the link of this health talk to your family and your friends. And please subscribe if you're yet to. I love you all and I remain your favorite health talk personnel on YouTube. Thank you very much and see you again.